NCSBN RN Test Bank 800 questions with answers newest full practice. Question 1. A 44-year-old client had an emergency cholecystectomy for a ruptured gallbladder. She complains of severe abdominal pain. Assessment reveals abdominal rigidity and distension, increased temperature, and tachycardia. Diagnostic testing reveals an elevated white blood cell count. The nurse suspects that the client has developed which of the following? Option A, gastritis. Option B, evisceration. Option C, peritonitis. Option D, pulmonary embolism. The correct answer is option C, peritonitis. The horrifying combination of a rigid, board-like, agonizingly distended abdomen, alongside a spiking fever, racing tachycardia, and a skyrocketing white blood cell count in a client whose infected gallbladder violently ruptured and spilled toxic bile, is the absolute, classic, undeniable clinical picture of catastrophic, life-threatening peritonitis. Question 2. A 35-year-old client asks what balanced anesthesia is. The best explanation for the nurse to give the client would be that balanced anesthesia is which of the following? Option A, a type of regional anesthesia. Option B, uses equal amounts of inhalation agents and liquid agents. Option C, does not depress the central nervous system. Option D, is a combination of several anesthetic agents or drugs producing a smooth induction and minimal complications. The correct answer is option D, is a combination of several anesthetic agents or drugs producing a smooth induction and minimal complications. The nurse expertly explains that balanced anesthesia is a brilliant, highly calculated symphony of multiple, specific anesthetic drugs working together. This masterful combination perfectly achieves deep unconsciousness, absolute pain control, and total muscle relaxation, while radically minimizing the massive, dangerous, and toxic side effects of using just one massive dose of a single agent. Question 3. A 29-year-old client is admitted for a hysterectomy. She is worried and complains of a tightness in her chest, a feeling of suffocation, lightheadedness, and tingling in her hands. Her respirations are rapid and deep. Assessment reveals that the client is experiencing which of the following? Option A, having a heart attack. Option B, wanting attention from the nurses. Option C, suffering from complete upper airway obstruction. Option D, hyperventilating. The correct answer is option D, hyperventilating. The terrifying sensation of suffocating, intense chest tightness, extreme lightheadedness, and bizarre tingling in the hands, all driven by wild, rapid, and excessively deep respirations, are the absolute, textbook, and unmistakable physiological hallmarks of severe, acute anxiety-induced hyperventilation. Question 4. A client develops complications following a hysterectomy. Blood cultures reveal Pseudomonas aeruginosa. The nurse expects that the physician would order an appropriate antibiotic to treat Pseudomonas aeruginosa, such as which of the following? Option A, cefeprizone. Option B, clindamycin. Option C, dicloxacillin. Option D, erythromycin. The correct answer is option A, cefeprizone. Pseudomonas aeruginosa is an incredibly vicious, highly resistant, and terrifyingly lethal hospital-acquired superbug. Cefeprizone is an extremely potent, heavy-hitting third-generation cephalosporin specifically engineered with the massive, targeted anti-pseudomonal firepower required to ruthlessly eradicate this deadly organism. Question 5. A couple is experiencing difficulties conceiving a baby. The nurse explains basal body temperature by instructing the female client to take her temperature at which of the following times? Option A, orally in the morning and at bedtime. Option B, only one time during the day as long as it is always at the same time of day. Option C, rectally at bedtime. Option D, as soon as she awakens, prior to any activity. The correct answer is option D, as soon as she awakens, prior to any activity. To capture the incredibly subtle, minuscule, and critical temperature spike that perfectly pinpoints the exact moment of ovulation, the woman must absolutely, rigorously take her temperature the very split second her eyes open in the morning, entirely before a single muscle moves or any physical activity falsely raises her core heat. Question 6. A client is having episodes of hyperventilation related to her surgery that is scheduled tomorrow. Appropriate nursing actions to help control hyperventilating include which of the following? Option A, administering diazepam 10 to 15 mg orally every 4 hours. Option B, of keeping the temperature in the client's room at a high level. Option C, having the client hold her breath or breathe into a paper bag when hyperventilation episodes occur. Option D, using distraction to help control the client's hyperventilation episodes. The correct answer is option C, having the client hold her breath or breathe into a paper bag when hyperventilation episodes occur. Hyperventilation causes a massive, dangerous blow-off of vital carbon dioxide, triggering terrifying physical symptoms. The absolute best, most immediate, and highly effective mechanical intervention is forcefully instructing the frantic client to rebreathe their own exhaled air from a paper bag, instantly trapping and forcing the lost carbon dioxide straight back into their crashing bloodstream. Question 7. A client delivered a stillborn male at term. An appropriate action of the nurse would be to do which of the following? Option A, state, "You have an angel in heaven." Option B, discourage the parents from seeing the baby. Option C, provide an opportunity for the parents to see and hold the baby for an undetermined amount of time. Option D, reassure the parents that they can have other children. The correct answer is option C, provide an opportunity for the parents to see and hold the baby for an undetermined amount of time. In the unimaginably horrific, devastating aftermath of a stillbirth, the absolute most profoundly compassionate, healing, and vital nursing action is to tenderly offer the shattered parents unlimited, completely unhurried time to see, hold, and weep over their baby, allowing them to forge a final memory and take the crucial first step into their lifelong grief. Question 8. A pregnant client is having a non-stress test. It is noted that the fetal heartbeat rises 20 beats per minute, lasting 20 seconds, every time the fetus moves. The nurse explains that this finding indicates which of the following? Option A, the test is inconclusive and should be repeated. Option B, further testing is needed. Option C, the test is normal and the fetus is reacting appropriately. Option D, the fetus is distressed. The correct answer is option C, the test is normal and the fetus is reacting appropriately. A non-stress test that vividly displays explosive, robust fetal heart rate accelerations soaring 20 beats per minute above baseline and holding strong for 20 seconds exactly in sync with every fetal movement is the absolute, gold standard definition of a flawlessly perfect, reactive, and beautifully reassuring test, proving undeniable fetal vigor and brilliant oxygenation. Question 9. Which stage of labor lasts from delivery of the baby to delivery of the placenta? Option A, second. Option B, of third. Option C, fourth. Option D, of fifth. The correct answer is option B, third. The clinical, absolute, and universally defined third stage of labor begins the exact millisecond the screaming baby is fully born and officially ends the very instant the massive, bloody placenta is completely and entirely expelled from the mother's uterus. Question 10. On the third postpartum day, the nurse would expect the lochia to be which of the following? Option A, rubra. Option B, serosa. Option C, alba. Option D, scant. The correct answer is option A, rubra. For the first brutal 3 to 4 days following the massive trauma of childbirth, the raw, bleeding placental site relentlessly sheds a heavy, dark red, and bloody discharge packed with tissue debris and clots, which is clinically and absolutely defined as lochia rubra. Question 11. What is the nursing priority after a carotid endarterectomy? Option A, nifedipine. Option B, furosemide. Option C, magnesium salicylate. Option D, nitroglycerin. The correct answer is option A, nifedipine. Maintaining blood pressure is critical to prevent graft blowout and preserve vascular integrity in the surgical area. Question 12. What is the first action when a client with a knee fracture complains of leg pain? Option A, assess vital signs. Option B, elevate the extremity. Option C, perform neurovascular check. Option D, instruct on PCA pump use. The correct answer is option C, perform neurovascular check. Neurovascular integrity is the priority assessment to detect bleeding or circulatory compromise after fracture reduction. Question 13. What is a goal for a client with Meniere disease? Option A, of frequent ambulation. Option B, prevention of fall injury. Option C, 3 meals per day. Option D, prevention of infection. The correct answer is option B, prevention of fall injury. Balance disturbances and vertigo make fall prevention the primary safety goal for these clients. Question 14. Which order for arterial insufficiency is contraindicated? Option A, neurovascular checks. Option B, elevate legs on pillows. Option C, arteriogram. Option D, no smoking. The correct answer is option B, elevate legs on pillows. Elevation of the legs decreases arterial blood flow to the distal extremities in clients with insufficiency. Question 15. Which lab value requires immediate intervention for a cardiac client on digitalis? Option A, serum potassium. Option B, serum sodium. Option C, serum chloride. Option D, serum hemoglobin. The correct answer is option A, serum potassium. Hypokalemia potentiates digoxin toxicity, increasing the risk of life-threatening cardiac arrhythmias. Question 16. How should a nurse handle a visitor entering an isolation room without appropriate apparel? Option A, risk of infection to visitor. Option B, follow hospital policy. Option C, client is at extreme risk of infection. Option D, follow CDC guidelines. The correct answer is option C, client is at extreme risk of infection. The client's compromised immune system makes them highly susceptible to pathogens, requiring protective apparel for all visitors. Question 17. What is the action when a do not resuscitate client is found not breathing? Option A, notify physician. Option B, remind family of order. Option C, discuss with family. Option D, call a code and resuscitate. The correct answer is option D, call a code and resuscitate. A request for resuscitation from the family overrides a do not resuscitate order in the immediate crisis moment. Question 18. What is the nurse action if a visitor faints in the hall? Option A, sit victim up. Option B, elevate victim legs. Option C, apply cool cloth. Option D, place head between knees. The correct answer is option B, elevate victim legs. Elevating the legs improves cerebral blood flow and helps the victim regain consciousness. Question 19. What is the benefit of showering prior to testicular self-examination? Option A, better memory. Option B, large bulky testicles. Option C, soft relaxed scrotum. Option D, less pain. The correct answer is option C, soft relaxed scrotum. A warm shower relaxes the scrotal sac and lowers the testicles, making them easier to palpate. Question 20. Which data is significant if a client on hydralazine has a blood pressure of 70/40? Option A, pedal pulses. Option B, low intake. Option C, potassium level. Option D, a pulse rate. The correct answer is option B, low intake. Hydralazine is a vasodilator. Inadequate fluid volume can lead to severe hypotension when vasodilation occurs. Question 21. What is the first action when admitting a myocardial infarction client? Option A, to obtain vital signs. Option B, a connect cardiac monitor. Option C, ask about chest pain. Option D, a complete history profile. The correct answer is option B, connect cardiac monitor. Cardiac monitoring is the first priority to assess for lethal arrhythmias and rhythm disturbances. Question 22. What symptom is associated with an abdominal aortic aneurysm? Option A, upper left shoulder pain. Option B, leg numbness. Option C, decreased urination. Option D, pulsation in the abdomen. The correct answer is option D, pulsation in the abdomen. A pulsation in the abdomen is the most common and often only symptom of an abdominal aortic aneurysm. Question 23. Which lab result indicates aplastic anemia? Option A, a hemoglobin 9.2. Option B, low blood cell counts. Option C, low WBC and red cells. Option D, red blood cells 1 million. The correct answer is option D, red blood cells 1 million. Aplastic anemia is defined by severe pancytopenia including red blood cell counts below 1 million. Question 24. Which food is recommended for protein deficiency? Option A, cantaloupe. Option B, rice. Option C, chicken. Option D, green beans. The correct answer is option C, chicken. Chicken is an excellent source of protein and vitamin B6 needed for protein synthesis. Question 25. Which drug might be discontinued due to decreasing blood cells? Option A, prednisone. Option B, atenolol. Option C, gentamicin. Option D, phenytoin. The correct answer is option D, phenytoin. Phenytoin is associated with blood dyscrasias including aplastic anemia. Question 26. What is the priority for a client with hypocalcemic tetany after thyroidectomy? Option A, report to physician. Option B, range of motion. Option C, check potassium. Option D, administer phenytoin. The correct answer is option A, report to physician. Tetany is a medical emergency requiring calcium replacement to prevent laryngeal spasm and airway compromise. Question 27. What is the most important question for a client with folic acid deficiency? Option A, aspirin use. Option B, alcohol use. Option C, red meat intake. Option D is stool assessment. The correct answer is option B, alcohol use. Chronic alcohol intake is the most common cause of folic acid deficiency in adults. Question 28. What occurs when a toddler ingests a caustic alkali? Option A, mouth ulcerations. Option B, respiratory depression. Option C, inhaled fumes. Option D, lead poisoning. The correct answer is option A, mouth ulcerations. Caustic alkalis cause immediate chemical burns and ulcerations to the oral and esophageal mucosa. Question 29. What is the purpose of weighing a child with nephroses? Option A, nutritional management. Option B, check intake accuracy. Option C, check eating habits. Option D, assess edema changes. The correct answer is option D, assess edema changes. Weight gain is the most accurate clinical indicator of fluid retention and edema in nephroses. Question 30. What is the explanation for alopecia in a child with leukemia? Option A, unavoidable side effect. Option B, wig makers available. Option C, hats are protective. Option D, hair will grow back. The correct answer is option D, hair will grow back. Reassurance that hair loss is temporary provides significant comfort to the child and family. Question 31. How can a child with leukemia be encouraged to eat? Option A, reinforce attempts. Option B, focus on weight. Option C, increase appetite. Option D, make mealtimes pleasant. The correct answer is option A, reinforce attempts. Positive reinforcement of eating attempts is more effective than focusing on volume or weight. Question 32. What is the best way to clean teeth when toothbrushing is contraindicated? Option A, water pick. Option B, rinsing. Option C, hydrogen peroxide. Option D, baking soda. The correct answer is option A, water pick. Water picks provide effective cleaning and gentle gum stimulation without abrasive mechanical contact. Question 33. Which role-play activity helps siblings cope with a terminally ill brother? Option A, understanding. Option B, role acting. Option C, storytelling. Option D, a drawing. The correct answer is option B, role acting. Role acting allows siblings to act out feelings and fears in a controlled, safe manner. Question 34. What is the primary management for rheumatic fever in the acute phase? Option A, range of motion. Option B, massage. Option C, immobilization. Option D, a heat application. The correct answer is option C, immobilization. Resting the involved joints is essential to promote healing and reduce the inflammation associated with rheumatic fever. Question 35. What is the priority in the acute phase of rheumatic fever? Option A, maintain contact with parents. Option B, provide rest. Option C, nutritious diet. Option D, school interest. The correct answer is option B, provide rest. Physical and psychological rest is the most critical intervention to prevent permanent cardiac damage. Question 36. Which symptom of sodium salicylate toxicity should parents identify? Option A, tinnitus and nausea. Option B, dermatitis. Option C, unconsciousness. Option D, chills. The correct answer is option A, tinnitus and nausea. Tinnitus and nausea are early signs of salicylate toxicity requiring immediate medication adjustment. Question 37. How long does rheumatic fever joint pain usually last? Option A, 3 weeks. Option B, relieved by aspirin. Option C, responsive to ibuprofen. Option D, 3 to 6 days. The correct answer is option A, 3 weeks. Rheumatic fever joint inflammation typically subsides within 3 weeks as the disease runs its course. Question 38. What is the immediate action for caustic alkali ingestion? Option A, a vinegar or lemon juice. Option B, phone doctor. Option C, go to emergency room. Option D, induce vomiting. The correct answer is option A, vinegar or lemon juice. Neutralizing the agent immediately is necessary to limit the extent of chemical injury. Question 39. A postoperative client has no bowel sounds on the second day. What is the most likely cause? Option A, normal postoperative response. Option B, infection. Option C, paralytic ileus. Option D, bowel perforation. The correct answer is option A, normal postoperative response. Absent bowel sounds are a normal physiological response immediately following major abdominal surgery as peristalsis returns. Question 40. What solution should be used to irrigate a nasogastric tube? Option A, sterile water. Option B, tap water. Option C, sterile saline. Option D, dextrose solution. The correct answer is option C, sterile saline. Sterile saline is isotonic and prevents the electrolyte depletion associated with water irrigation. Question 41. What is the primary nursing responsibility for a client with a nasogastric tube that is not draining? Option A, advance the tube. Option B, irrigate with sterile saline. Option C, apply more suction. Option D, remove the tube. The correct answer is option B, irrigate with sterile saline. Irrigation is the standard nursing intervention to clear obstructions and ensure tube patency. Question 42. Which client is at highest risk for urinary retention following surgery? Option A, client with epidural anesthesia. Option B, client receiving intravenous fluids. Option C, client who is ambulating. Option D, client who has voided recently. The correct answer is option A, client with epidural anesthesia. Epidural anesthesia interferes with bladder sensation and detrusor muscle tone, leading to retention. Question 43. What is the primary risk of using prophylactic antibiotics before surgery? Option A, a cathartic action. Option B, a wound infection from anaerobic bacteria. Option C, client anxiety. Option D, intraoperative fever. The correct answer is option B, wound infection from anaerobic bacteria. Antibiotics are used prophylactically to target intestinal flora and reduce post-surgical wound infections. Question 44. A child with patent ductus arteriosus is to have surgery. Is this an open or closed heart procedure? Option A, open heart. Option B, closed heart. Option C, bypass surgery. Option D, angioplasty. The correct answer is option B, closed heart. Patent ductus arteriosus repair is a closed heart procedure as it does not require cardiopulmonary bypass. Question 45. How much atropine should be administered if the order is 0.15 mg and the supply is 0.4 mg per milliliter? Option A is 0.06 milliliters. Option B is 0.38 milliliters. Option C, 2.7 milliliters. Option D, insufficient information. The correct answer is option B, 0.38 milliliters. Dividing 0.15 by 0.4 equals 0.375, which rounds to 0.38 milliliters.